All right, so have you ever gotten those, like, weird little bumps under your tongue?
Oh, absolutely.
You know what I'm talking about. You're like,
Yeah.
what is that?
Yeah, get a look in the mirror like, whoa.
Yeah, and then you start poking it and prodding it.
Exactly. And then it's like, is this something I should be concerned about?
Right. So that's what we're diving into today on this deep dive is bumps under the tongue.
I love it.
We're going to figure out what's normal, what's not, and like what you should actually be concerned about.
Sounds good. Because it can be concerning, right?
It can. It can be very concerning,
Oh,
especially when it's something, inside of your body. You're like, what's going on in there?
yeah, it's the mouth.
Yeah,
Like that's where we do a lot of important things.
exactly.
Talking, eating.
Yeah, so we're going to get to the bottom of it. So to start off, if you're like investigating these bumps, where would you even begin?
Well, I think just like a detective, right? We want to start with those most likely suspects. So those are going to be our most common, usually harmless causes of bumps under the tongue.
Okay, so who are the usual suspects in this case?
So I want you to think back to maybe you've had those little ulcers. You know what I'm talking about. Canker sores.
Ugh, canker sores.
The worst, right?
The worst. But like, why? What causes those? Do we even know?
That's the interesting thing about canker sores is that they're very common, but we don't fully understand what causes them.
Interesting.
Research suggests that stress, minor injuries, even the foods we eat, acidic foods, spicy foods, they can all play a role. Even genetics can be involved.
Wow, so it really could be anything.
It really could be.
Well, our source material mentioned that B vitamins and zinc could potentially help prevent them. Is there any truth to that?
There's definitely some evidence suggesting that these nutrients, they might play a role in maintaining a really healthy oral environment, right?
Right.
And so B vitamins, they're essential for cell growth and repair.
Okay.
So if you have a deficiency, maybe your mouth is a little more susceptible to those pesky ulcers.
Okay.
Zinc is very interesting because it has anti-inflammatory properties, and so it
Right.
may actually help speed up the healing process.
Interesting.
Yeah, so it's like giving your mouth those building blocks. It needs to stay in tip-top shape.
That's fascinating. So it's not just about what we eat, but making sure our bodies have the right nutrients to handle it all.
Exactly.
Okay, so we've got canker sores. What else?
All right, let's move on to another common culprit. And this one, you've probably experienced this. Have you ever bitten your cheek accidentally and you get that little, like, bubble of fluid under there?
Oh, yeah, all the time.
It's like a little tiny water balloon, right?
Yes.
Well, mucous cysts are very similar, except they happen under the tongue.
Oh,
And it's the same sort of concept. The salivary glands, they might get a little bit blocked or irritated, and then the mucus, instead of flowing freely, it kind of starts to build up.
so it's basically harmless, just like those cheek bumps.
Most of the time, yes. They'll usually just go away on their own without any intervention.
Wow.
It's pretty amazing how the body works.
The human body is amazing. It can heal itself.
It really can.
But our source material also mentioned another type of cyst called a lymphoepithelial cyst. What's the deal with those? That sounds way more serious.
Yeah, you're right to point that out. That's a very important distinction. While most mucus cysts are harmless, lymphoepithelial cysts are a bit different. They're less about simple irritation and more about the types of cells that are involved. So these cysts often contain cells from your lymph system, which is a key part of your immune system.
Okay, that already sounds more complicated.
It doesn't have to be more complicated, but it does change our detective work a bit. You see, lymphoepithelial cysts, while still relatively uncommon, can sometimes be a sign of an underlying condition that needs a bit more attention.
Like what kind of conditions are we talking about?
So sometimes they can be associated with autoimmune disorders. That's where your immune system kind of mistakenly attacks your body's own tissues.
Right.
And in even rarer cases, they can be linked to HIV infection.
So they're not necessarily caused by HIV, but they can be a sign that something else is going on.
Exactly. It's like, we found a clue, now we need to investigate a little further,
I like that.
right? It's a little mystery.
Yeah.
And that's why it's always important to see a doctor if you have any persistent bump under your tongue, especially if it just seems unusual or it doesn't go away on its own, because they can help determine what type of bump it is.
Makes sense. All right, so we've covered those common culprits, the ones that are usually more annoying than anything else. But what about those bumps that might be a bit more serious, the ones that make you wonder if you should be concerned? We'll get into that right after this. All right, so we talked about those common causes of bumps, but now let's get into some of the stuff that maybe should cause a little more concern. So this next one, it's something that I think a lot of people have heard of but don't always understand.
Yeah, HPV,
HPV, yeah, a big one.
human papillomavirus. So
Human papillomavirus, it's a mouthful.
it is a mouthful, both literally and figuratively, I guess, right?
Right, exactly.
So when we talk about HPV, what do we actually need to know?
Well, I think the first thing to remember is that it's actually incredibly common.
Okay.
Most sexually active people will contract some strain of HPV in their lifetime.
Really?
Oh, yeah, it's that common.
Wow, I did not know that.
Yeah, and the good news is that most of the time our immune systems are amazing and they clear the virus without us even knowing that we had it. No symptoms, no fuss. However,
Of course, there's a however.
there's always a however, right? Certain strains of HPV can cause cellular changes.
And those changes can sometimes lead to lesions.
Okay.
And you guessed it. Those lesions can appear as bumps under the tongue.
So it's not just like any HPV infection, it's certain strains that can potentially cause these bumps.
You got it. That's exactly right.
Okay. And so if that happens, if you have one of those strains and you get the bumps, what do you do?
Well, most HPV infections, thankfully, resolve on their own.
Okay.
But some of these lesions, if they're left untreated, they can increase the risk of developing certain types of oral cancer. However, and this is big as however, this is not a death sentence by any means.
Right.
Early detection and treatment are key.
So how can you tell if a bump might be HPV related? Like what should we be looking for?
Well, unlike those simple cysts that we talked about,
Mm-hmm.
HPV lesions often have a very distinctive look.
Okay, what does that mean?
Our source material describes them as having a cobbled appearance.
Cobbled.
Yeah, cobbled.
Like cobblestone.
Like the stones, exactly.
Okay.
So imagine those bumpy, irregular surfaces. That's what they look like.
Interesting. Okay. So that's something to look out for. So we've got the cobblestone, we've got HPV. Is there anything else that we should be like really aware of when we're looking at these bumps?
Yeah, let's switch gears a little bit and talk about salivary stones.
Salivary stones, okay. I'll be honest, the name alone makes me a little squeamish.
I understand that. They sound a little bit strange, but they're actually more common than you think.
Mm.
And what they are is they are these little hardened deposits that form when the mineral salts in our saliva clump together.
Okay, so kind of like those tonsil stones that some people get.
Yeah, you can think of them that way. They're pretty similar in that they're both mineral deposits.
Okay.
But tonsil stones kind of hang out in the crevices of your tonsils, whereas salivary stones, they form within the salivary glands or their ducts. And it's those ducts that are responsible for carrying the saliva from the glands into our mouths.
Got it. So our source material mentioned a connection between salivary stones and dehydration and even certain medications. What's the link there?
That's a great question, and I think it highlights just how interconnected our bodies are. So dehydration, that can actually decrease our saliva production.
Okay.
And when that happens, it makes it way more likely for those minerals to concentrate and form those stones. And so some medications can also reduce saliva flow as a side effect,
Oh, wow.
which again could increase that risk.
So staying hydrated is crucial.
It's so important.
Not just for our overall health, but like you said, to keep those salivary glands happy.
Exactly. And it's not just about the amount of fluid that we're drinking, it's also what's in those fluids.
Okay.
Because think about it, drinks that are high in sugar or caffeine can actually dehydrate us.
Oh, right. Yeah.
So it's really essential to choose water, herbal teas, just those hydrating beverages throughout the day.
Great advice. So to recap, HPV lesions, they can have that cobbled appearance. Salivary stones can be linked to dehydration and certain medications, both potentially troublesome but treatable,
Yes.
especially with early detection, which I feel like is the theme of today.
Yes, early detection is key.
So it's a good reminder that even though these might seem like small, minor annoyances, they can sometimes be our body's way of saying, hey, something's a bit off. Pay attention to those signals, right?
Listen to your body. It's telling you something.
And seek professional advice when needed, which we will talk more about after this quick break. All right, so I think it's time to address the elephant in the room.
Oh, okay.
When we talk about bumps and lumps and anything like that, I think there's always a little bit of fear.
Of course.
Is this cancer?
Right, is this serious?
Yeah, and I think especially when we're talking about something in our mouths, it feels a little more
Invasive.
invasive, yeah, and just scary, I think.
Yeah.
So let's talk about it. Our research did mention salivary gland tumors
Yes.
as a possible cause, thankfully rare,
Very rare.
for bumps under the tongue. What can you tell us about those?
So salivary gland tumors, it's true, they can occur,
Okay.
but it's so important to remember that the vast majority of these are benign, meaning that they're not cancerous, They tend to grow very slowly, and they don't spread to other parts of the body.
Okay, that's reassuring.
Yes. But, and this is a big bit, just like with many things, early detection is key, even with benign tumors.
Got it. So how can you tell the difference between a harmless bump and then something potentially more serious?
That is the question.
Right. Because we've talked about all these different things. Our source material did mention some red flag symptoms to look out for. So what are those?
So most bumps are harmless. They're going to resolve on their own.
Right.
But if you notice a bump that's growing rapidly,
Okay.
it doesn't go away after a couple of weeks, it's accompanied by other symptoms like persistent pain,
Okay.
numbness, difficulty swallowing,
Oh, wow.
even an earache. Those are all signs that you need to go to the doctor.
So basically, like, trust your gut.
Yes, trust your gut.
If something feels off,
Listen to your body.
it's better to be safe than sorry
100%.
and get it checked out.
Yeah.
And speaking of, like, being proactive about your health,
Yes.
regular dental checkups are important for this, right?
So important. This is like routine maintenance for your oral health.
Right.
And dentists are trained to spot those subtle changes that we might miss and catch potential issues early on when treatment is usually the most effective.
Right, because they see it every day.
They see it all the
I
time.
know what they're looking at.
Exactly.
What to look for.
Yes.
Yeah.
Okay, so before we wrap up, I wanted to touch on home remedies really quickly.
Yep.
Our source mentioned a few things, like saltwater rinses, avoiding irritating foods, spicy foods, things like that.
Are those actually helpful at all?
They can be. You know, those everyday bumps and irritations.
Yeah.
Think about a saltwater rinse. It can really help reduce inflammation, promote healing, and avoiding spicy or really acidic foods can just prevent further irritation. Think of it like you're giving your mouth a little soothing spa treatment.
I love that.
Right.
A little TLC.
A little TLC goes a long way.
But it's important to remember that these are not a substitute for professional medical advice.
Exactly.
Yeah.
Exactly. Home remedies can really complement professional care, but they can't replace it.
Perfect. Well, this has been, I feel like I've learned so much about something I didn't even really think about that much before.
It's fascinating, isn't it?
It is, and it's amazing what a little knowledge can do.
Absolutely. It can really ease your worries, right?
Yeah.
Understanding the why behind things and just knowing when you need to take action.
Couldn't have said it better myself.
Yeah.
Big thank you to you for joining us on this deep dive into the world of bumps under the tongue.
Thanks for having me.
Remember, everybody, knowledge is power, and
It's
sometimes
fun time.
a little bump is just a little bump.
That's right.